Good day, folks. Alfie Vente here once again of Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a terrific day. Today, I'm going to talk about the way I use acupuncture in my practice. I'm a massage therapist and I do use acupuncture from time to time depending on the patient. So, we're going to talk about that in a little bit. So, primarily, I use acupuncture to treat pain, dysfunction, and tightness of an area. But I may also use it for potential physiological side effects because there's certain acupuncture points that actually do multiple things. They do things locally to help treat, for example, somebody with elbow pain, somebody with foot pain, somebody with a headache. They can do local things to help clear up certain issues, but they also have a deeper physiological effect. Now, I'm going to call it a side effect, mainly because as a massage therapist, my primary reason for treating patients is working on, soft tissues and joints. I'm going to put it in quotation marks, a side effect. So I'm going to talk about my thought process in terms of how I go about figuring out whether I may use acupuncture or not. So let's talk about a scenario. Somebody comes in and they say, Alfie, I've got this elbow pain. I'm not sure what's going on. It hurts. I need it treated. But on their health history, they also mention that they have digestive issues. So when you fill out the health history, it has, items such as, do you have any neurological problems? Do you have any lymphatic issues, digestive issues? And at times when I'm scanning, I find something that might be significant in terms of maybe helping that patient out. So that's a scenario. So what I would do is I would not only use massage therapy, I may use acupuncture. In the back of my mind, I'm thinking about points that may also potentially help with a person's digestive issues. So there are points around the elbow that might be helpful for that person. Now, mind you, I'm sort of giving you a snapshot. There's more to it than that. But generally speaking, that's how I would think in terms of planning out a treatment for this person. So I would primarily treat, in that scenario, I would primarily treat the issues, the soft tissue issues with the elbow. There's probably muscles, fascia that's very, very tight, and I would use massage therapy to help with releasing some of those structures. Now, there are a number of things that acupuncture can do. Not only can it help with decreasing pain locally, it can also help with pain away from that area. So there's certain points that I'll, needle that might be helpful for example, a shoulder. That's the point could be further down the lower limb, the upper limb, right? That could help with the shoulder, such as this point here. I might use that to needle to help decrease the person's symptoms around the shoulder. So the other thing too is I would look at the secondary potential benefits of using certain acupuncture points, as I mentioned before, to help maybe help with that person's digestion. But for me, I'm looking at it as a side effect. As a massage therapist, as a soft tissue expert, that's the way that I would be looking at it. Now, here, first of all, before I talk about, I'm going to give you 3 examples in a second of different acupuncture points that do have deeper physiological effects, not only local, but also deeper physiological effects. But there's 4 things. There's actually more than 4 things right off the top of my head that acupuncture can help with. I mentioned local pain. I also mentioned pain that's away from that area. It can also help loosen up the fascia that's very, very tight. And also the 4th thing, and we're going to talk about that a bit more, is the deeper physiological side effect. Again, I'm putting side effect in quotation because for acupuncturists and other therapists, they will look at that as more of the primary thing that they're dealing with. So the 3 examples of points that have both a local effect and a potential physiological side effect. The first one I'm going to show you up here is a point called liver 3. It's between the big toe and the second toe. And this one can be helpful potentially for headaches and migraines. I always say potentially because you're not just looking at like one acupuncture point. It's actually like a combination of different points that may be helpful for that person. So this point may be good for headaches and migraines, but the primary reason I would use this for is if somebody's complaining about a foot issue or potentially an ankle issue. So I'd be using this point for that. That's how I would be thinking. But if the person's coming in again with say as a secondary thing on their health history, they're mentioning they get migraines and they get these headaches, it might be something that I might want to look at in terms of needling. The second one here is Heart 7. This one is great for the wrist, obviously, because locally it can help treat the area that you can see here with a picture. It's needled around the wrist. It can help with wrist issue, hand issues, anything with the forearms potentially. But as a deeper secondary physiological side effect, it might be able to help with anxiety and insomnia. So I do get a number of people coming in with like sleep issues. They may come in with like anxiety also tied with the sleep issues. And if they're coming in with wrist issues also as their primary for them coming in, I may look at this point to help them out with that as a secondary side effect. Finally, the third one, there's more than these three here, by the way. So I'm just giving you three different examples. So this is stomach 36, arguably the most important acupuncture point in all of acupuncturedom. So stomach 36, I would use, for example, somebody that might have knee pain, lower extremity pain. I would use it for local issues such as that. But not only does it help with that, it can help with digestion, for example, energy and moods. So it does a whole bunch of different things, stomach 36 does, but those are some of the things that it can do. So somebody might come in and say, listen, Alf, I've got this knee pain, on the outside of my knee. Can you help with that? Of course, I'll be considering, the soft tissues around the area. But if on their health history or by chance they talk about, something with their digestion, it might not be a bad idea to sort of discuss like the secondary effect to help with the digestion, energy, or moods. So there you go. And the bottom line for this is that acupuncture is not only good for local issues, pain issues, tightness, so on and so forth, but there's also secondary side effects. Again, I'm going to put this in quotation marks because that's not my primary thing to work with internal stuff, internal issues with people. So if you've got any questions, please feel free to give us a call at our clinic number 416-644-8894 or email us at admin@ventepainrelief.ca. Don't forget to check out our self-care website, vprc.ca. Again, I have future announcements of live classes to teach different self-care techniques. So pay attention to that. Please like, share, subscribe, pass this on to people that you feel this might help. We always appreciate that. I want to thank you in advance. Again, this is Alfie Vente of Vente Pain Relief Clinic and vprc.ca. Have yourself a terrific day, and we'll see you the next time around.